This appointment was for an oncology cancer treatment. It was a follow-up appointment with a nurse practitioner. The goal was to assess how the patient was feeling to the treatment to see if there are any modifications that needed to be made. The room was small, just two chairs, an exam table, a counter and a sink for washing their hands, and a small computer desk for the nurse to sit at with a um, typical stool that spins. The patient's 58. Her husband was there with her. He did not say a word through the entire appointment, in his 50s as well. And the provider was the nurse practitioner who was in her 30s. Um, Here's the list of the vocabulary that came up. Um, I do not remember antifungal actually coming up in the appointment. I believe I added this after the fact um, when I did some research and found out that antivirals and antifungals are sometimes prescribed prophylactically for patients who are receiving chemotherapy. The patient had recently started chemotherapy. I think she was going to have her third infusion. Um, and the reason she was there was just to see how she was feeling. The nurse asked her how she was feeling. The patient said she was feeling fine. She actually looked great. She reported that she was just a bit more tired than usual. The nurse then asked a series of questions, all being potential side effects of chemotherapy. How are you sleeping? Any leg pain? Have you been nauseous? Diarrhea, headache, dry mouth, etc. So the patient looked a little annoyed with that, as if to say, "I've already been through this with you." I said, "I'm good." So the nurse then said, "Well, you're probably going to start seeing symptoms a few weeks down the road." Um, which, if I was the patient, I don't know if I would have appreciated that or not. Um, the patient then reported she wasn't able to get one of the three medications she was prescribed. When asked what the medication was, the patient said she couldn't remember the name, but she remembered it was an antiviral. This was good to see only because we're so used to deaf patients and not knowing their medications. It was just nice parallel to see that hearing people do this too. Um, the nurse knew exactly what medication she was referencing. She said, "Oh, the antiviral medication. The pharmacist wanted to speak to you today, and I think that is why." The patient then just said, "I couldn't get it because my insurance wouldn't pay for it. It was too expensive." And the nurse then said, "Let's see what Don has to say. He may want to get you signed up for the special assistance program." I'm not sure who Don, at the time, who Don was. Didn't know if Don was the pharmacist. Didn't know if Don was a social worker. A social worker would typically be the one to sign patients up for programs such as this. The patient then asked if there was another medication that she could take, and the nurse really didn't want to veer from what she was prescribed because it was the best one for her issues. Um, the nurse then let the patient know that they were closed the week of Thanksgiving, and that's how she stated it. So the patient asked, "When should I come in?" And the nurse then said, "Well, you could come in the day before Thanksgiving," which just confused me a bit, and the patient as well. And then said, "Or you could come in the Friday before Thanksgiving." So the patient just said, "Okay," and just looked a little perplexed, as probably did I. The nurse then said to stay here. I'm going to go see if Donald can see you. So upon the doctor calling Don, it became apparent that Don was the actual pharmacist. And when we went back into the room, the nurse said to the patient that Don will get a prior authorization from your doctor, and that was it. So the patient asked if she was set for today and was going to head to the infusion clinic. But before she left, the nurse wanted to double check her, um, not exercise level, but if she was basically, I think her thought world was, are you getting out of bed and doing stuff and not just sitting in bed all day long? Is that's not going to help you. Um, so the patient reported that she, does some things, gets tired, and then does a little bit more. And the nurse just reminded her that, keep as busy as you can. There were no changes in the prescribed course of treatment because the patient was doing really well. She may miss one of her infusions as a result of the Thanksgiving holiday, which she didn't seem thrilled about. For somebody on chemo, I mean, the patient seemed good. She was in a good mood. She was a little perturbed with the nurse, I think, at times. And this was in the beginning stages of chemotherapy. So the nurse was probably dead on and very accurate in saying that you will get sick later from the chemotherapy. Um, and I just mentioned how the patient was a little perturbed. I think she just kind of felt like, um, why are we going through these questions? And again, we see the deaf patients. Why am I telling you this again when I've already told you? Or so the same frustration comes up. Again, good to see. The Thanksgiving and the comment with we're closed the week of Thanksgiving, but then said to come in the day before Thanksgiving. Um, the patient just looked a little like, well, what's up with that? And I'm not sure if the nurse didn't see her facial expression or just ignored it, but she just moved on. As far as demands, even if the deaf patient didn't ask, I would have asked, what's the special assistance program, just to make sure that the patient understood what that was, so that if by some chance the office were to drop the ball, the patient could follow up on it and say, hey, I'm supposed to be getting help getting my prescriptions. Can we continue with this process? I would have asked who Don was, just to make sure the patient understood who Don was, to make sure that if there is a social worker and a pharmacist, that she knows there's two people right now involved with this medication issue, or if there was just one. Because I like to make sure patients are fully informed when they leave, I would have elaborated on a few things, one being the prior authorization, just to say, how long does it usually take the doctor to get to these? And if I don't hear from you, saying the medication's all set, now you can go pick it up. When should I follow up? Just to make sure that the ball doesn't get dropped. And also, just before leaving, I probably would have double checked with the patient again to say, do you want to follow up about the Thanksgiving schedule? It was a few weeks out, but just to make sure that the patient could get scheduled on the day she wanted to get scheduled, if that was what she was going to do, I might have facilitated that a little bit as well. So my thoughts were, why is she being prescribed an antifungal medication, which wouldn't have risen to the level of a demand, and that's something I did research afterwards, and that prophylactically it is given to many patients on chemotherapy. It was really good to do an oncology appointment and see somebody who looked really well. My mother died of breast cancer when I was very young, so to go into an oncology appointment and see someone feeling great is just makes everything go smoother for me. Over time, I've had no problem interpreting these types of appointments, but it just makes it easier when you know the patient's still feeling good. And I also felt just frustrated for the patient because it almost was like well, our schedule doesn't fit your schedule, so we're just going to cancel the treatment and don't worry about it. Which, if I was a patient, I'd have been pissed. So just felt a little frustrated for the patient, as she didn't say anything, but you could tell she was kind of like, what the hell's going on? And the only physical distraction was the husband. He didn't say anything, but he was just fidgety. I think he was the driver. He probably didn't really want to be there. Controls. I'm familiar with chemo and treatments and cycles, etc., but I'm not familiar with chemotherapy drug names for the most part, so I'm always having to ask the providers to spell them for me. I did not do any preparation, as I simply knew that we were going in to do a follow-up to a patient who recently started chemotherapy infusions. And that's it.